Let's review the IRRAflow 2.0 dual lumen catheter. When looking at the packaging, you'll notice on the label it shows the catalog number as ICGS 020 with 2 sealed packages. When opening the catheter packaging, you'll find the IRRAflow 2.0 dual lumen catheter, a hard stylet, a soft stylet, and the tunneler. When you open the IRRAflow accessory kit, remember that the only component you're probably going to use is the male-to-male connector to flush the catheter. The items included in this pouch are the bacterial dome, which you can fill with bacitracin, protective covers for tweezers or Kellys, and the male-to-male connector. To properly prep the IRRAflow catheter, you're going to want to ensure that you have a thorough flush. Starting with the irrigation lumen, you're going to want to turn off the stopcock to ensure there isn't fluid coming back towards you and it's lubricating the entirety of the catheter. Next, you'll need to flush the drainage lumen, utilizing the male-to-male connector, and thoroughly flushing the drainage lumen. You'll want to pay close attention that there is plenty of fluid exiting the tip of the catheter. Before disconnecting the syringe, make sure you clamp the drainage lumen to keep the lumen lubricated. Once you've flushed the catheter, we then need to insert the soft stylet. The soft stylet will go into the drainage lumen. You'll want to unclamp the lumen and advance the soft stylet, ensuring it advances smoothly. Now the catheter is fully prepped and you're ready to insert. Once you've found your access point, you'll want to drill your twist drill hole, ensuring that you're staying in line with your trajectory. Next, you're going to measure about 5 centimeters posterior to your cranial access point, using a scalpel to make an incision down to the bone. Prior to inserting the IRRAflow catheter, it's critical to ensure the dura has been fully incised. Then, you're going to take a pair of Kellys or whatever tool you'd like to create a tract back to that cranial access point. Next, you're going to use our tunneling tool to act as a conduit to get the catheter from the posterior incision to the cranial access point. Once that's complete, you're going to take your prepared IRRAflow catheter and slide it into the tunneling device. You'll want to pull the tunneler and advance the catheter until the hub of the catheter touches the skin at the posterior incision, and then pull out any additional slack to the bifurcation. The catheter is going to turn up on top of itself, aligning to your trajectory. Holding the catheter between the 5 to 7 centimeters mark, use the straight section of the catheter to line up to your external landmarks, leaving the large loop in place. Pull the soft stylet out of the drainage lumen approximately 3 cms, and open the stopcock on the irrigation lumen to check for CSF. Once CSF drainage is confirmed, make sure to clamp the lumen. Then, suture the catheter in place per your normal procedure, while ensuring adequate skin closure at the cranial access point and the reverse tunnel site. A preferred approach is to create a large catheter loop that is secured with multiple sutures that do not compress the catheter's lumens. During this process, intermittently confirm CSF drainage to ensure that the sutures are not kinking the catheter. A large clear occlusive dressing, such as a tegaderm, should be used to cover and secure the catheter. Finally, add a 3-way stopcock to the catheter's drainage lumen. This will allow you to draw CSF samples, if required, or to maintain access during treatment.